I just want to thank you all today for joining our 9th session in our CAHME Mentorship Circle series. If you don't know, my name is Melissa Cross and I'm the Education Manager for CAHME. Today as our host, we have our President and CEO, Anthony Stanowski, who will lead a discussion today with Eddie Hooker, MD, DRPH, the Associate Director of Masters of Health Administration at Xavier University. A little bit about Eddie. Since 2003, Dr. Hooker has been teaching in the Department of Health Services Administration at Xavier University. He teaches medical terminology, clinical medicine, and population health. Dr. Hooker also continues to work clinically in the emergency department. He has an active research agenda with over 80 peer-reviewed publications, including one of his most recent articles we are here to discuss today, titled Abandoning the GRE and Gmat, Improve Diversity in a Graduate Program for Health Administration. So I'm going to pass it now over to Anthony to start our session.
Thank you very much for that introduction. And Eddie, thanks for coming on to the session today on this really, really important topic. I think with the pandemic and COVID-19 kind of kicking in, it's become more of an issue. And, we all know the areas around the people not being able to get into testing sites and accreditors needing to adjust their requirements. And we received some directives from the U.S. Department of Education and from JHAE in terms of how do we kind of look at that. One of the first calls I got was from Sister Nancy Linnenkugel at Xavier, a very good friend, great administrator, who gave me a call and said, Anthony, what do we kind of do in this process? And all within that context, this research has been going on. And, to me, it's fascinating to kind of read some of the things that you've come up with. But I'm going to ask you, if you wouldn't mind, just giving this group a little overview of what your research found.
Yeah, thanks, Anthony. Starting in the early 2010s, we started questioning the value of GRE and Gmat. Prior to up to 2014, we required you to have the students to at least have 50th percentile in the verbal and 25 in the quantitative. But we actually did some internal research and we're like, you know what, this doesn't predict anything. The kids at the top of the class would have a low GRE GMAT and kids at the bottom of the class had a great score. So it had no predictive value. I think we looked at the R squared and it was like 3%, something silly. So starting in the class entering in 2015 through 2017, we no longer looked at the GRE GMAT. Our graduate school still required us to collect that information, but we did not look at it. It was not part of the holistic evaluation. And so what we decided to do was to look and see what happened both with graduation and also with diversity. But the short story is we doubled our diversity. Our people of color went from about 16% to about 32%. So we were already doing well compared to some programs nationally, but now I think we're doing much, much better. To be almost a third people of color is really great. And all of the kids that we've admitted that had low test scores during that 2015 to 17, we had I think it was 8 people of color that would not have been admitted. They would have been discriminated against by the GRE GMAT, and every one of those kids has graduated. Every one of those kids is working full-time in healthcare administration. So to me, it's, we just need to get rid of the GRE and GMAT. It's, as it's been said previously, it just proves that you're wealthy enough to pay for a prep class. And so let's get rid of it.
Eddie, when you talk about the impact on diversity, equity, inclusion, I think, I go back to a 2016 article that was written by The Atlantic, more of a popular press article. But one of the things, the article was called The Problem with the GRE. And it began with, the exam is a proxy for asking, are you rich? Are you white? Are you male? Your research kind of bore out those conclusions in there. Talk a little bit more about what you found. I think, some of the graduation rates and the employment information that kind of resulted from the research you did is interesting.
Yeah. So again, as I said, we found that the kids did fine. We let people in that we weren't looking at the scores, but when we look back at the scores 15 to 17, we found that, these kids with these very low scores did great, did well in the program, had a good GPA, finished, our program still for all residential students requires a administrative residency / fellowship. And they all completed those and did well. So I think it kind of confirmed that the GRE GMAT is not predictive of success. And that's been shown in doctoral programs previously at Vanderbilt. They showed that they got rid of it. And had they continued to use it, they would have not admitted many people of color. Not everyone, but like 85% of those people finished, which is much higher than the normal doctoral success rate of about 50%.
Yeah. And in your research, it showed among Black population, 100% of all the students you admitted graduated, and 100% of them were employed afterwards too. So it kind of bore that out, that it's really not a good predictor of future success.
Right. And if you look back, and we didn't look at this specifically because it was not the goal, but it also discriminates against women. So if you look at the GRE and GMAT, so again, bad test.
Yeah. Now, Xavier is one of the long-standing CAHME accredited programs. I think has been accredited by us probably since 1968. And one of the things around there is you do have some strict admission requirements. So what else do you use besides the GRE and the GMAT? Or you no longer use those, but I mean, what else do you use?
We actually don't look at the GPA. If you do an internal evaluation of your GPA, it doesn't predict well either. Okay. So we use a holistic evaluation. You've got to obviously have a completed application. You have to have a bachelor's degree. You have to do a personal statement. And then we require interviews of everyone. They have to have at least 2 interviews. And I'm telling you, in a 30-minute interview, you can really start seeing whether somebody has got the right stuff and whether they're going to feel comfortable in the program and be a good fit. And so we feel that is the best marker. But we got rid of all the other stuff because it eliminates good candidates.
Yeah. Yeah. I'm surprised about the GPA.
Yeah.
Yeah.
It's how many of us in this conversation today had some trouble in our freshman year in college. Okay. So I just don't think that that's the marker. I want to look at, if you're getting C's as a senior, that's more important. But if you showed me that you kind of improved, or maybe you've been out for 3 to 5 years, what does the GPA mean at that point? Nothing. Absolutely nothing. And if you start using these artificial cutoffs, you're going to lose some really good people. I mean, some of my best students are the ones that have been out for 3 or 4 years who weren't that mature when they were in college and finally grew up, and now they're like superstars. So we feel that it's not a good marker.
Yeah. Things like problem solving, interpersonal skills, those are the things that you're looking for in those questions. I've got to share with you, I mean, one of the things that we were reading about just in kind of prepping for this is how the FISC guide, which is arguably one of the core sources that students use when they evaluate programs, they've actually eliminated the GRE, GMAT median scores for the programs that reported in their 22 guide, which to me was fascinating. And what's your take? Is this a trend that you see in the industry or in universities and higher education, that people are going, yeah, do we really need to think about whether we do this?
I think so. And again, I'd love to hear from the other people on the call, but I think a lot of us have started just saying that this is really not a good test. And again, you're costing these students a lot of money. We used to make the kids, they'd get a low score and they'd have to retake it to be able to apply. And, complete waste of money. It didn't change it. And almost every one of them that retook it got better and got over the minimums. Well, what did that prove? It proved that they had enough money to spend another, whatever it is, $200-300, or take a prep class. And that's not making them a better healthcare administrator.
Yeah. It's interesting, again, some research on ETS, which is the testing. It's a $2 billion, it was a $2 billion industry prior to the pandemic kicking in. And then once the pandemic hit, it went from a $2 billion industry to a $1 billion industry. And a fascinating change there. But you've got, the Princeton review organization that enables people to kind of go to educational sessions around how to learn for the test and the like. So a whole industry is kind of built up around this.
It really is. And you see this with law, you see this with medicine. These tests are gameable. And if you have the money to take the prep classes, you do better. Okay. My daughter had got the 100th percentile on the MedCat, but it was because she had the money to take a prep class and then had the resources to live in my house and not have to make money to study continuously for a month before the exam. Well, now, wait a minute. So you're automatically going to discriminate against people that don't have that money.
Yeah.
And that's wrong.
Yeah. I see a couple people commenting. Steve Bowman, your comment first. Could we open Steve's mic up and just kind of talk a little bit about what you've seen?
You bet. Yeah, no, we with the pandemic, I mean, as it went away, we realized that, we were starting to get some applicants that really hadn't shown up before, but they're doing very well in the program. And, as we've talked about it, we're also seeing some, I think similar to UNC, some additional part-time, working adults who are early in their careers. And, I think that we consistently get comments and calls from prospective students that are like, is the GRE required? And they're kind of holding their breath, hoping that it's not, and probably going somewhere else if we had said, yes, it's required. And so far it's been a plus. We looked at the GRE as it related to our outcomes back in 2013-14 for our previous CAHME reaccreditation, and really didn't, it was mildly correlated, but, in terms of GPA at graduation, but really not in terms of achieving competencies or success in the field. So, that's why I was curious about this group. I was hoping that the sort of the common theme here wouldn't be, we have to go back to the GRE.
Yeah. Well, and let me go over to Michael Thompson, and Michael, you've got some comments too about UNC Charlotte. If we can open his microphone up, thank you.
Yeah, thanks, Anthony. Leading into the pandemic, we were already considering eliminating the GRE for some of the same reasons we've heard, and we began experimenting with that and moving to a much more holistic review. And we've noticed that the competitive profile, other than the GRE, hasn't changed, the GPAs and other things. But what we saw really was an uptick in those early careerists. We were afraid we were going to open the floodgates to directly out of undergrads, and we didn't see that. And so now we're dealing a bit more with how to support those students a bit more as they enter the program. And so it's good that they're coming in with some of the professional skills that our students coming directly through don't have. And so they've enriched the classroom, but they haven't been in the same kind of academic environment in the same way. So we're trying to figure out how to best support those students. At the same time, we're trying to figure out how to support so many of the students who were caught up in their last few years of education during the pandemic being sort of abruptly put online and so lacking some of the other skills that we've seen. So it's a moving target, but it's really been a positive experience.
Oh, and it's interesting you're talking about the support services that you provide to students around with the change that are going on there. So could you talk about that some more? What are some of the services that you use?
Well, we've trying to make more use of our Center for Graduate Life has a writing support center. So writing skills is a chronic weak problem. And so we provide that. We provide students resources. We're doing more intentional in professional development activities, more the acculturation to the professional work environment that's really targeted to the students we have coming directly out of undergraduate programs or through our early entry program. And so having these early careerists in the classrooms actually helps with that process by having in-class mentors, because when their colleagues are saying it, it's much more effective than what we were saying exactly the same things. So we've worked with our student organization, which is the ACHE student chapter. They've established mentoring programs and trying to link students across cohorts to provide more of that one-on-one insider perspective. We've worked with our career center to develop some things that we integrate into some of our other courses. But that's changing now based on the changing demographic in the student cohort.
Thanks, Michael. Steve, I'm going to go to you, but let me go to Gwen next before Gwen, you had some comments about two different universities. So I know you have experience at both.
Yeah, thank you for the opportunity to share. I was at Pfeiffer University, graduated from their MHA MBA program and went back as an instructor, ended up as the director of the program. In my last 2 years, we did some extensive research and found that that entrance exam, the only purpose it served was to show us that these students could take a standardized exam. It was not an indication of their ability to be successful in the program. So we got rid of it. When I moved on to Belmont Abbey, that was one of the things that we did some pre-initiation research there as well. And based on what we found in the Charlotte and North Carolina area, and really all over, is that GRE, Gmat really are deterrents for students to apply to graduate school. I would have to raise my hand and say, if I had to do it, I would not have entered a master's program. It really is not an indicator. And as I have heard this morning, it really does eliminate a lot of minority students that turn out to be outstanding contributors to the healthcare industry.
Absolutely. You know, it is interesting, was mentioned by Stephen, and I think it's really important that you found a slight correlation with GPA. And that's really all that's been shown. If you look at all the research on this, the R squared is less than 10%. Well, that's useless, you know? So, you know, people publish and they're like, oh, well, it predicted the outcome, 10%. Yeah, so.
You know, I want to say at CAHME, on our annual report, we used to require that programs report the median GRE and Gmat scores, and we no longer ask for that information or report it on our public website. We do track, though, whether programs require the GRE or the Gmat. And I have some interesting numbers to kind of give folks in this. So prior to the pandemic, 57% of all CAHME accredited programs required the GRE and 30% required the Gmat. So 57% GRE, 30% the Gmat. Now, according to our newest data from the 2021 to 2022 academic year, that number is 13% for the GRE and 8% for the Gmat. So a significant drop in the number of programs that are requiring those tests. That's an interesting kind of view of it from the CAHME perspective, and I think a pretty dramatic decrease.
Absolutely.
Now, I want to kind of bring up one piece of information, or one thing that was interesting that I actually read in the Chronicle of Higher Education just this month that was almost a little counter to this trend. And MIT is bringing back the SAT. And after not requiring it for several years, what the comment from their dean was, our ability to accurately predict student academic success at MIT is significantly improved by considering standardized testing. And this was from the Dean of Admissions, Stu Schmiel. Now, the Chronicle had some issues because they weren't able to document what the word significant was talking about, whether it was statistically significant or other kind of areas around here. The comment that was used in the article is they said, MIT says the test helps to find, and in quotes, diamonds in the rough. And again, that kind of goes against, you know, some of the research that we've shown, you know, in here that's kind of, said, hey, are you really maybe eliminating diamonds in the rough in here? Now, my question with MIT's approach, though, and Eddie, I'll ask you to talk about it a little bit, and then have other folks kind of comment on as well, is what I wonder about is, will the highly elite schools, the MITs of the world and the like, again, I know this is an undergraduate admission type of thing, but could they potentially use this as, well, most schools don't require the GREs, but we do because we're better? Is that going to be a marketing tool that people kind of use? And, what do you think of that approach? I mean, potentially I'm looking at MIT doing it and going, hey, yeah, we're MIT, we require it. We don't care what anyone else is doing.
Well, I think they're requiring it says we don't care about diversity. That's what they're saying, because they've got plenty of applicants and they don't really care. And I think that's criminal, in my opinion. I think they should be called on the carpet for it. And we should not be discriminating against people of color. And we know this test does. And so they basically are just saying, we don't care. So if they want to whitewash MIT, good way to do that.
Yeah.
So that's my opinion. I curious to see what other people think.
I could see a lot of shaking heads in there. Anyone else?
I agree. I think it's a concern, and there's a larger secular concern that we have. The UNC system is looking to move towards more of a performance-based way of allocating money to campuses, shifting from enrollment-driven systems. And so that has some positives, but one of the concerns is that because of indicators like progression rates, graduation rates, and our campuses sets itself up as an access institution, that might drive people to being much more selective in recruitment, just to game with the outcome metrics that they're getting compensated for. So there are some larger things that we're concerned about might be influencing these decisions about diversity.
I mean, you could even, Anthony, and I'm not saying we should do this, but you could even, from a CAHME standpoint, say we don't want programs to use it. I mean, are we there yet? Are we there to the point where we say it should not be used because it is discriminating against people of color?
Yeah, and that's a good question for our Standards Council. What CAHME does with our accreditation criteria, we say, you need to determine the types of students that you want to recruit, and then you need to look at your accreditation, the requirements that you have to make sure that you get the types of students that you want to recruit. And like you said, Eddie, if this is a distinguishing factor that eliminates people of diverse backgrounds, is it really, is it counterproductive to what programs want to try to accomplish? Any other, I know there's a couple other program directors on here, and I won't pick you out by name, but interested in your thoughts. I don't want to put you on the spot, but there's a couple folks on here that I'd be interested in hearing from. So let me kind of open it up and just pause for a second.
I was recruited to start the first graduate program at Belmont Abbey College. And fortunately, it is an MHA program. One of the considerably outstanding factors that we looked at was the GRE Gmat. And sharing with them what our extensive research showed was paralleled with what their research showed. And that was that there is not a strong enough correlation between the success rate in a graduate program and the success rate and the score in these standardized testings. Some of the items in the standardized test are items that some minority folks have never, ever heard. I mean, that's a long-standing issue. And our decision was based not just on my thoughts and feelings and the thoughts and feelings of the upper echelon of the university, but research. And research does not lie. Some research might be slanted in one direction or the other, but when you have the overwhelming amount of research that's been done, and the fact that so many universities have merged together in their thoughts and feelings about the benefits of this exam or these exams. You have to wake up and smell the roses, so to speak. You are losing an opportunity to bring in very well educated students. I mean, when you require a certain GPA, I think that's more than adequate. Sometimes students struggle their last year of college, and if you allow them in the program with a slight variation in the GPA and monitor them closely, and as Michael was saying, offer them opportunities for tutoring and that type of thing, what we have seen is that these become outstanding students. So I think it is a hinder when you handcuff them and handcuff your programs and handcuff the future leaders in this industry by requiring these tests. I am just such a strong advocate because I too was one of those people who hesitated in going to graduate school because of the requirement of these standardized tests and my thoughts and feelings about those tests. Had I had to do that, I don't think I would have gone to grad school, and I certainly wouldn't have my doctorate degree at this point and in a position to bring in future leaders and educate future leaders in this field.
Yeah. And Eddie, that's one of the comments in your article, I think, that you end with, is that with diversity in the C-suite in healthcare still not being where it should be, and where most of the sources of the C-suite are students who come from CAHME accredited programs, is this really kind of hindering it long term? So
I think it clearly is. And, everybody's, trying to do things to recruit diverse students, get students of diversity, students of color, going to maybe traditionally Black colleges and things like that. Get rid of the GRE GMAT, you'll get a lot more bang for your buck. I'm serious, I think, and I think that everybody I think on this call probably has already done that. It sounds like everybody just kind of said, forget this.
Steve Bowman, I noticed you have a comment on the chat about your state has 3 HBCUs, and prior to dropping the GRE, I'll let you kind of go through and talk about that.
Yeah, I mean, I came back into the director role last June and had been away for a few years. And I was surprised when I came back that, I was talking with some of my colleagues and they said, well, we've never had any students from any of the 3 HBCUs.
Wow.
Shocked. And so, we now have several, really high quality students. And in fact, I even had somebody internally that said, well, you'll never get good students from there. And I'm thinking, really? So, and it's been really the opposite. And we've actually started to, sort of create kind of the word of mouth. And I think, but the GRE I was a big part of it because, it was just one more barrier to get people to even, know about our program and take the leap. So, it's really hard in with that group, especially to see us kind of going back to the way we were. We're kind of on a good roll and creating some inroads in terms of increasing our diversity even more.
Well, Eddie, let me kind of give you some any last thoughts before we sign off.
I think everybody has said it. We need to be done with this, and I really hope the Standards Council will consider actually removing it. It's not benign. This is not a benign test. This is a bad test that causes really bad things to happen. So let's just get rid of it and be done with it and not allow it in our industry.
Eddie, thank you very much. And just a reminder, the Standards Council does not require the GREs or the GMATs. The proposal that you have is that we basically say you should not use the GREs or the GMATs. And that's what we'll bring the Standards Council for. It's up to the individual programs based on the students that they want to attract, whether it's to kind of keep it. But once again, thank you all for participating on this call. This was fascinating. Eddie, thank you very much for sharing your research with us, and really appreciate the ability to have this conversation with you and the other folks on this call. So thank you all.
Thank you for watching today's webinar in our CMC series. For more information or to view past webinars, slides, or to register for upcoming webinars, please go to www.cahme.org/CMC. Thank you.